Hello everyone, I am Dr. Kalaramya, CSO of Resplice Institute. In this video, I am going to discuss about how to create proper diet plan for children with autism. Many autistic children are using multiple supplements due to malnutrition and functional deficiencies. So these are the major challenges for kids are having malnutrition issues. So the first thing is kids in autism spectrum disorder are usually having sensory issues and picky eating things. So when it comes to food, the major sensory issues we are observing related to texture, taste and smell, and for some kids it is depends on the temperature of the food also. So because of that they are unable to accept all the food items. And when it comes to food sensitivities and allergies, when we give certain kind of foods, kids are usually having problems with bloating, nausea, diarrhea, constipation, some kind of discomfort, and some kind of food allergies will be seen. So other things include digestion and absorption issues. These things mainly because of improper pancreatic enzymes and GI motility. So GI motility means how food is moving inside the gut. So these kids are already having some kind of poor movement of food inside the gut. So there are some popular diet plans for autism. So when it comes to GFCF diet, it only covers how to eliminate gluten and casein from the food. But the major thing which we are missing in GFCF diet is we are unable to eliminate inflammatory foods from the diet. Because of that, kids will exhibit some kind of behavior issues because we are already giving inflammatory foods in this diet. And keto diet, this keto diet is basically implemented for epilepsy patients. And in this keto diet, we are eliminating carbohydrates, and in place of carbohydrates, we are giving excess amount of fats. And detox juicing. In this detox juicing, we are giving fruits and vegetables in juice forms. But because of this detox juicing, we are unable to provide proper fiber content. So it will cause some kind of digestion issues, but it will help in GI motility. And Mediterranean diet. In this diet, we are mainly focused on giving raw foods, which includes fruits, vegetables, herbs, seeds, nuts, and some kind of whole grains. But in this Mediterranean diet, we are giving salads, right? So because of that, kids who are already having some kind of picky eating things, they are unable to accept this diet also. And GAPS diet, this diet is basically for gut and psychological syndrome patients. So in this diet, we are mainly focusing on how to heal gut lining, so that we will achieve how gut dysbiosis correction and proper immune system balance. And when it comes to name check protocol, in this protocol we are giving a high amount of fibers, probiotics, prebiotics, and with some healthy oils along with some supplements. So this diet is also not acceptable for picky eating kids. So to keep in mind, for every diet we are having some advantages and disadvantages. To combat this problem, we are going to implement some proper comprehensive diet plan for autistic kids. To plan proper comprehensive diet plan, we have to divide food into inflammatory foods and non-inflammatory foods based on food intolerance test. So we basically have two types of tests, food intolerance test and food allergy test. In this food intolerance test, it includes it identifies how IgG antibodies are reacting, and in food allergy test, IgE antibody testing involves. So with food intolerance testing, it is like basically gives information about how subclinical inflammation is going on inside the gut and body. And in food allergy test, those symptoms are like clinically visible, like we are seeing some kind of rashes or allergy on the body with this food allergy test. So foods comes under inflammatory foods, we have to eliminate them completely from the diet, because those foods cause all these bloating issues and behavioral things in the kids. So we have to give non-inflammatory foods. In this non-inflammatory foods also, we have to enlist what are the low FODMAP diet. So FODMAP means fermentable oligosaccharides, disaccharides, monosaccharides and polyols. So basically, the meaning of FODMAP diet is some kids are unable to digest carbohydrates. So it is like we are eliminating what foods are not easily digested from the diet. So in this low FODMAP diet, I'm giving you some quick information. So these are the FODMAP foods. So this is basically involves 2 to 6 weeks of short-term plan. So we are going to eliminate high FODMAP foods with low FODMAP foods. As you know, what foods comes under high FODMAP, like onion, garlic, apples, plums, and hard cheese, and broccoli. All these things are comes under high FODMAP foods. So these things are difficult to digest. So we are going to replace high FODMAP foods with low FODMAP foods, which includes rice, oats, kiwi, eggs, spring onions, butter, and soft cheese kind of things. So once we got clear idea about what are the non-inflammatory foods and low FODMAP foods, so now we have to work on what are the kid sensory foods and what are the non-sensory foods. So kids, as we discussed earlier, kids are already having some picky eating challenges and sensory challenges. Based on that, we have to imply some kind of desensitization programs for those kind of kids. And in that, we have to work on how gustatory, like taste, smell, and texture. Based on that, we have to slowly incorporate the foods into the kids' diet with the small amounts and with proper dietitian guidance and with proper desensitization techniques. We have to incorporate these low FODMAP foods. And once we are having introduced non-inflammatory foods and low FODMAP diet and along with managing sensory needs in these kind of kids, but still there is a problem with how to achieve balanced nutrition in these kind of kids. So balanced nutrition involves the correct amount of carbohydrate, protein, fat, fiber with the proper hydration. To achieve this, we have to follow all these things. And if we give proper balanced nutrition also, we can expect some kind of we can see some kind of digestion and absorption issues in autistic kids. So this digestion issues mainly involves GI motility and pancreatic enzyme insufficiencies. So to know how enzymes are releasing and to know more information about how pancreatic enzyme insufficiencies, we have a test called fecal elastase test and our pancreatic elastase test. Based on that, we can rule out whether the enzyme sufficiency is there or not. Based on that, we will plan some alternative treatment options. So if enzyme deficiency is detected, we have to implement some proper alternative enzyme replacement therapies, and we have to correct even the GI motility issues also. If the problem is with absorption, we have to concentrate mainly on the gut microbiota. So in this gut microbiota, if there is any disturbance in the good and bad microbiome imbalance in the gut, we have to treat it with probiotics, prebiotics, along with some gut microbiota transplantation therapies. So we have to plan this meal plan correctly based on non-inflammatory foods, and based on that we have to get some idea about low FODMAP diet, and from that also we have to identify what foods are kids sensory friendly, and based on that we have to plan proper balanced nutrition. Then we have to think about digestion and absorption. For that we need proper dietitian and nutritionist guidance to achieve proper nutrition or nourishment for autistic kids. After following all the low FODMAP diet, non-inflammatory foods, balanced nutrition based on kids' sensory needs, but there are few things we have to avoid must. Those include sugar, junk food, processed foods, refined foods, and foods which are like contains weedicides and pesticides, because these foods are already having effect on gut microbiota. They will disturb the symbiotic relationship in the gut, and they alter gut microbiota. And so kids with autism who are already having some intolerances with milk, nuts and wheats, so these things have to be avoided completely. So the gist of our comprehensive diet plan is to include non-inflammatory, low FODMAP, sensory friendly, balanced nutrition. Thank you. I hope this video helps you to plan how to create proper diet plan for autistic kids.